Thank you, guys. So today onwards, we can discuss the ICD-10 PCS. ICD means everybody know, right? International Classification Disease, 10th revision. PCS means Procedural Coding System. Procedural Coding System. Where we can use this ICD-10 PCS codes? Inpatient facility. Procedures. We can use this ICD-10 PCS codes in the inpatient facility procedures. Okay, if they perform the procedure in outpatient setting, we can go with CPT codes. If they're done in inpatient facility, we can go with PCS code. If they're done diagnosis either inpatient or outpatient, ICD 10 CM codes. Okay, these three books we are going to use for the exam. For diagnosis 10 CM, for outpatient procedures CPT, for inpatient procedures PCS. What is the meaning of inpatient? Inpatient means
patient admitted more than 24 hours in facility.
inpatient means patient admitted in the hospital, discharged after 24 hours. The patient discharged within 24 hours considered as outpatient. Okay. So in the outpatient departments, you will get like emergency department, same day surgery, radiology, pathology, medicine, ENM and all. So in inpatient, the admission. Okay. After admission, if they're done in the inpatient facility, PCS codes. What is the code structure of CPT?
5-digit numerical.
5-digit numerical code. Okay. PCS code structure.
Alphanumerics, 7-digit.
Very good. 7-digit alphanumerical. Every code contains 7-digit alphanumerical codes, guys. 7-digit alphanumerical codes. So here we need to learn about the 7 characters. Each character has specific meaning in the PCS. We need to learn about all the character definitions. Okay, we can't get the direct code like ICD-10-CM or CPT. The PCS somewhat different compared to CPT and PCS. We don't get direct individual procedure code. We need to identify each character in the PCS code. Actually, in the CPT now we have individual code for each separate procedure, but in the PCS not like that. We need to learn about the characters and we need to identify each character. Total 7 characters, right? We have some specific name for each character in these 7 characters. These are the 7 characters in the PCS code. Section. First character name should be section. Body system. Root operation. Body part. Approach. Device. Qualify. We are going to learn about each character here. Note down the characters. Section. Body system. Root operation. Body part. Approach. Device. Qualifier. So here first character section. Section was represent general type of procedures. Okay. What type of procedures they are performing will be represented section. These all are the sections, guys. General type, what type of procedures they are performing, you will get in the section. Like medical or surgical related. Obstetrics means delivery related. Placement, administration means either medication or blood transfusion. Measurements, extracorporeal assistance like mechanical ventilation, dilation, dialysis, extracorporeal therapies, osteopathic, other procedures, cryotherapeutic, imaging, nuclear medicine, radiation oncology. Up to new technology, we have some sections. These are the first characters of the sections. Okay, 0, 1, 2, 3. These are the fixed values, guys. Suppose your procedure was related to medical and surgical. The procedure start like 0. If you seen the options, any procedure start with 0, no, that procedure was related to which section?
Medical and surgical.
Medical and surgical related section. Okay, 0 series procedures all are medical and surgical related section. So in the book, 86% of the course was related to medical and surgical only. 86% of the procedures was related to medical and surgical. So if you learn the medical and surgical related section, you will get almost of the PCS. Remaining sections was not having much guidelines. So if you understand the medical and surgical related procedures, you will get PCS easy. So now whatever we are going to discuss, all are related to medical and surgical related section. Our procedures was going to start with 0. So our procedure was start with 0 means, what is the second character in PCS code?
Body system.
Body system.
So here we have total 31 body systems, 31 root operations. Fourth character represents body part. Fifth character approach, total 7 approaches, then devices qualify. So here check, we have some specific fixed value in the characters. First character fixed, second character fixed values, third, fifth character. These 4 characters will get the fixed values. Okay, if you see in any procedure start with 0, that was related to which section?
Medical and surgical.
Medical and surgical.
Surgical. If your procedure going to start with medical and surgical, na, in the second character you will get 31 body systems. In this 31, any one body system you will get in the procedure. So how to identify the body system that procedure related, na? Based on fourth character, guys. Based on fourth character. What is the fourth character?
Body part.
So we can discuss first fourth character, body part. Body part means site of the procedure or location of the procedure. Site of the procedure or location of the procedure. Location where they are performing the procedure, that location you will get in the fourth character. Wherever they are performing the procedure, it represents in the fourth character. Suppose if they performed procedure in the lung was the location. If they done the procedure in knee was the location. Wherever they are performing a procedure, that should be the body part. Body part represents site of the procedure or location of the procedure. Clear?
Site of-
Site or location, same meaning. Site of the procedure or location of the procedure. Next. Clear? Huh? Next. How we need to identify the body system, guys? How you people will identify the body system in procedure?
Based on the location of the
Based on the procedure location. Wherever they are performing the procedure, that location comes under which body system? Suppose if they done the procedure on lung comes under which body system?
Respiratory.
Respiratory. So remember, in the procedure note, they won't give I am performing the procedure on the particular body system. I am performing the procedure on the particular body system like that. They will give just a procedure. We need to identify the body systems and all. Wherever they are performing the procedure, we need to look for that note. And we need to identify where they perform the procedure exactly. And we need to check that location comes under which body system. Suppose check this question simply. What procedure they are performing in the 25th?
Closure reduction.
Can you repeat once again, sure?
Cast application.
Cast application. Which location they done the procedure?
Femur. Right
Right
femur.
femur. Shaft of
Right
the femur.
Right leg.
Right femur, right? Shaft of the right femur, they are performing the procedure, no?
Yes, sir.
So that should be the location. Femur was bone or joint? What is that?
Femur is bone only, sir.
Bone.
Clear? Bone. Now, how we need to identify the body system? That femur bone comes under which body system? We need to look.
Musculoskeleton.
Like that. Clear? We have total 31 body systems now. How to find the body systems and all? I will explain. I shared the PCS book in the group, right, already? Soft copy I shared. So if you open the soft copy, guys, simply you will get table of contents in the third page. Table of contents. Under the table of contents, you will get ICD-10 PCS tables. PCS index, PCS tables. Below the PCS tables, first you have medical and surgical. This is the section 00. First character 0. Below the medical and surgical, we have total 31 body systems. These are the body systems in the second character. We need to learn about all these systems. Second character here, if you see, central nervous system means the procedure start like 00. Third character, leave it. Only 2 characters you take. Peripheral nervous 01. Heart and great vessels 02. 03, 04, 05, 06. So here, the second character was fixed character, guys. 0, 0, 0, 1, 0, 2, 0, 3, 0, 4, 0, 5, 0, 6, like that. Based on the body system, each body system have a specific character here. Suppose your procedure was related to central nervous system. How the procedure will start?
0,
0, 0. So central nervous system means what are the body parts you get now? Brain, spinal cord, and okay. Brain and spinal cord should be central nervous system related. And cranial nerves. If any procedure they perform to brain or spinal cord, your procedure start like 0, 0. Then peripheral nervous system, extremities nerves, 0, 1. Heart and great vessels. Heart and great vessels, 0, 2. Heart means everybody know heart body parts and all. Great vessels means note down. Great vessels, note down. Aorta. Aorta. Superior vena cava. Coronary artery. Noted.
Yes, sir.
Next. Third, upper arteries, lower arteries, upper veins, lower veins. Next, body systems. Okay, upper arteries, lower arteries, upper veins, lower veins. So how we can divide the upper and lower, whether arteries or veins? What is the midpoint? Diaphragm was the midpoint, guys. For upper and lower arteries divide. Diaphragm was the midpoint to divide upper and lower arteries. Diaphragm, where it will be located?
Ribs.
Below the lungs. Okay. Diaphragm will be located in the below the lungs. Okay. Above the diaphragm, all the arteries and veins was upper arteries, upper veins. Below the diaphragm was lower arteries, lower veins. Clear? Above the diaphragm, all the arteries and veins, upper arteries, upper veins. Below the diaphragm was lower arteries, lower veins. So here we need to check, guys, where it will be documented. Like we need to get the idea that artery or vein, where it will be documented in our body. Like suppose if they mentioned femoral vein, it was upper vein or lower vein?
Lower.
Lower.
Lower vein. Carotid artery,
Upper.
upper artery. So we have basic idea where it will be located in our body. Then easy. Next, lymphatic and heme. Eye related procedures. Ear and nose sinus related procedures. Respiratory system. Mouth and throat. Here there is no digestive system, guys. Gastrointestinal. They divided as mouth and throat separate. Gastro, stomach and intestinal separate. Hepatobiliary and pancreas. Hepato means
Liver.
liver. Biliary means gallbladder and biliary tract. And pancreas. If they done the procedure, liver, gallbladder, biliary tract and pancreas, your procedure start like 0F. Then endocrine, all glands. Now, if you observe skin onwards, based on the depth, the body system will be changed. If they done the procedure on skin level, it should be H. Subcutaneous tissue or fascia, J. Muscle level, K. tendon level, L, bursa and ligaments, M. So where they are performing the procedure, it should be important, guys. At what depth they are performing the procedure, whether skin level or muscle level or bone level or subcutaneous level. Okay, because now location will be same. Suppose they are planning the debridement on muscle level, you will get separate body system. Same location they done on subcutaneous level, you will get this different procedure. So at what depth they are performing the procedure, it should be important. While we are coding mostly lacerations and debridements, you will get this type of body systems. While we are coding the debridement and laceration repairs, we need to check at what depth they are performing. Then bones, we have three body systems: head and facial bones, upper bones, lower bones. Okay, then upper joints, lower joints. So note down the midpoint where we can divide the bones and joints upper and lower na lumbar 5. L5, which means hip and hip below, lower bones and joints, above upper bones, upper joints. Here we need to get idea, guys. The mentioned body location was either bone or joint. Suppose previously you seen right closed reduction of right femoral shaft. It was bone or joint?
Bone.
Bone. Upper bone or lower bone?
Lower bone.
Lower bone. Lower bone means what is the second character?
Zero Q.
Lower
Q.
zero Q. So here also see in the answer 0Q it was starting, right? In the answer also you seen 0Q, right?
Yes, sir.
Clear? Like this we need to check. Any doubt? Next, urinary system T, female reproductive system U, male reproductive system V. Anatomical regions general. In our body have the anatomical region, body regions like thoracic region, cranial region, abdominal region, pelvic region. If they perform the procedure in the regions, W. Upper extremities means hands, lower extremities means legs. When we need to take upper and lower extremities now, whenever they not mention the bone or joint name, just they mentioned like hand, lower leg, upper leg, below knee, toe, finger, like this, we need to go with upper and lower extremities. If they mentioned specifically like right femur and wrist, knee, shoulder, either bone or joint name, we need to go with bone and joint body systems. Okay, suppose if they mentioned right femoral shaft fracture, do not take lower extremities. Femur was on the lower extremity, not like that. We need to go with specific bone. If they done the procedure for ankle, what is the body system?
Joint.
QS.
Zero?
S.
Zero. Yes.
Zero, yes, correct. Because ankle was lower joint. Correct? Suppose they done the procedure for kidney, what is the body system?
Zero T.
Zero T. They done for the uterus.
Zero U.
Zero U. They done for the thyroid gland.
Zero G.
Zero G. They're done for the esophagus.
0D.
0D. Now you get idea, right? Second character. Body
Yes.
systems.
Yes.
Total we have 31 body systems. Okay, these are the fixed values, guys. Okay, these all are the body system values. If you identify the exact body system, you will get the second character. How we need to identify the body system? Based on the body part. If you check the location first, fourth character, body part, but that location comes under which body system, you will get second character automatically. First, once we open the procedure note, look for the location, fourth character. Then automatically you will get the second character. Okay, 4 and second interrelation. Next, third character we can discuss later. Come to the fifth character. What is the fifth character in the PCS?
Approach.
Approach.
Approach. Tell me generally what is the meaning of approach?
Like open laparoscopic. How will the done procedure? Percutaneous or open?
Normally tell me who, not PCS.
To reach the anatomical
Reach
site.
the
Anybody
location.
said somebody approach you means what's that meaning?
They are
Position or
getting contact with the body.
Contacting or reaching information, right? Same here also. Approach means how we are reaching the procedure site, the way how we are performing the procedure. Okay, what technique we are using to perform a procedure. It should be represent fifth character. How we are reaching the procedure site, our way of reaching and how we are performing the procedure. It should be represent fifth character. Total we have 7 approaches. In these 7 approaches, any one approach they will use to perform a procedure. Okay, we need to learn about these 7 approaches, guys. These are the most important in the PCS code, fifth character. If you identify proper approach, we can easily eliminate the options. We can easily eliminate the options. Where we can find these approaches in the PCS book? If you open the table of contents, come to the appendix A. Approach table, they documented, right? In the table of contents, if you find appendix A approach table, or you opened PCS means. If you're not opened, no problem. You will get this approach table. We have total 7 approaches. We need to learn about these 7 approaches, guys. This is the approach name, fifth character value, definition, and example. Once read the all approaches, everyone, we can start discussion.
The recording has stopped.
Take 5 minutes time and read all the approaches. I will ask now. Done. Have you read it?
Yes, sir.
Thank you, guys.
So,
This meeting is being recorded.
Thank you. So here check first what is the approach they given? External, right?
Yes.
What is the meaning of external approach?
Which is in the superficial occasions.
Hmm. What you understood on the external when we need to take? What's your understanding when we need to take external approach?
Too deep into the body, only superficial, that is on skin.
Without making any incision.
Yes. Skin level procedures, correct? Simply. They don't cut or they don't puncture or they no incision. Directly or indirectly, they will apply some pressure and they will complete the procedure. Skin level procedures. It was not cross the skin. Skin level procedures. What are the visible things? If they remove, it should be external. Okay? Visible things, if they remove, it should be external. And the skin level laceration, skin level debridement, or closed reduction of fractures, like application of the splint, casting, or nosebleed control, like electric shock waves, laser surgeries. This all comes under external approach. If they've done the procedure in the external approach, what is the fifth character value?
X.
X. Okay. Fifth character value should be X. Next, open approach. Here, they will cut the skin and other layers and they will reach the procedure site and they will complete the procedure. Again, they will suture it. Like organ transplantations. Okay, open CABG procedures, open appendectomies, any procedure. If they are done open, it should be open approach. Here they will cut the skin or other layers and they will reach the procedure site and they will complete the procedure. Again they suture it. It should be open approach. Next, percutaneous. Percutaneous means they will puncture or minor incision. They will create a small hole and they will complete the procedure, or they will puncture directly by using the needle and they will complete the procedure. Puncture or minor incision by using the needle or sharp object. Like suppose pus formed in the body. How they will remove the pus?
Incision with needle.
They will puncture the abscess, right? By needle they will puncture and they will remove the excessive fluids. It should be percutaneous. Like any fluid formation or gas formation, if they removed also percutaneous. In thorax area like thoracentesis, they will puncture the thorax area and they will press and they will remove the excessive gas. And it should be percutaneous. So note down when we need to take percutaneous. Needle, catheter, guided wire. If they used, it should be percutaneous approach. Guided wire. Okay, needle, catheter or guided wire. Percutaneous approach. Like needle biopsy. Okay, incision and drainage of the needle or catheter inserted procedures All comes under percutaneous. Next, percutaneous endoscopy. Scopy means
Visualization.
video. Okay, visualization. We will get the video. For that, scopies have small camera and they will insert in our body and they will watch in the computer and they will complete the procedure. You will get the recorded video. We can visualize the site and locations. Okay. So percutaneous endoscopy, when we need to take now, what are the scopies they will insert by creating a small hole or puncture? It should be percutaneous endoscope. Note down what are the scopies we can consider as percutaneous endoscopy. Arthroscopy, laparoscopy, laparoscope, and thoracoscope. Laparoscope, arthroscopy, thoracoscopy. If they used these scopies, it should be considered as percutaneous endoscopy. Clear? If you see in these copies in the procedure note, it should be percutaneous endoscopy, guys. We need to remember the scopies. Do not confuse. Okay? Like laparoscopic cholecystectomy, laparoscopic appendectomy. We need to go with percutaneous endoscopy. Like arthroscopic knee joint aspiration. Percutaneous endoscopy. Peg tube. Percutaneous endoscopic gastro tube. Percutaneous endoscopy. Next, via natural or artificial opening. In our body have some natural roots, right? Tell me some examples.
Mouth or anus,
Anus,
Nose.
ear, nose, umbilicus.
umbilicus, whatever. In our body have natural roots. If they use the natural root directly, and they will insert the instrument in natural root and they complete the procedure. Like endotracheal tube insertion, Foley placement, okay, transvaginal cervical circlage. If they directly perform the procedure in the natural route using the instrument, it should be 7. In the natural route, if they insert the scopies, it should be 8. Via natural or artificial opening endoscopy. Without scopy, they are using natural route and they are completing the procedure 7. In the natural routes, if they insert the scopies, it should be 8. Note down the scopies: colonoscopy, bronchoscopy, EGD. Along with these 3, extra note down: cystoscopy, hysteroscopy.
Can you name them once again?
Colonoscopy, bronchoscopy, EGD. Already we have 3 right here examples. Along with these 3, cystoscopy, hysteroscopy. These 5 scopies comes under via natural or artificial opening endoscopy. EGD is a gastroduodenoscopy, like gastric scope and all. Hysteroscopy to visualize the ovaries or fallopian tube. Cystoscopy to kidneys. Noted as scopies.
Yes, sir.
Thank you, guys. Next, last approach, F. Here, 2 approaches they used. These 2 approaches they used to complete a procedure. For a single procedure, they will use 2 approaches. Via natural or artificial opening with percutaneous endoscopic assistance. Two approaches mutually used to complete a single procedure. It should be F. Via natural or artificial opening with percutaneous endoscopy, like laparoscopic assisted open procedures, or laparoscopic assisted via natural or artificial opening procedures. One instrument they will insert in the natural route and they will take the laparoscopic assistancy and they will complete the procedures. Here mostly we'll get female reproductive system related procedures only, like laparoscopic assisted salpingo-oophorectomy, removal of fallopian tubes and ovaries. Okay, only female reproductive system related procedures you will get here.
Sir,
Clear?
even in hysterectomy, they will remove the uterus. They will cut the ligaments, everything.
Yes.
And they will remove through the vagina, natural.
They will take the laparoscopic assistance and they will insert the natural instrument in the vagina and they will remove the uterus. It should be F, or ovaries or fallopian tubes. It should be F. If they're not taking the laparoscopic assistance, directly they are inserting the instrument in the natural route and they've done the procedure 7. They've done scopy and natural route, then F. Clear? Huh? Any doubt, guys? Because already you read it. Now again I explained. Now again you can check. Now I will give the mark questions, practice questions. You need to answer the questions. Read once again carefully. Everybody should answer, okay? Done. In the first question, what is the fifth character? Tell me.
Laparoscopic.
What is the value?
Cutaneous endoscopy.
Four.
Percutaneous endoscopy value.
4.
Oh, I'm explaining this time now. See, in the fifth character, 2 options seen 4. 2 options we are seeing 0, right?
Yes.
Yes or no?
Yes.
This is the 7 character PCS code. In the 4 options, everything should be options na, in exam point of view. Okay. Everything should be options. You will get the 4 options like this. Any doubt? You've seen 4 options like this. First, check 5th character. They given the same number or different value in the 5th character. If they given the same value in the 5th character, no need to check the approach. If they given different values like 2 options 0, 2 options 4. Now, if you identify the exact approach, can we eliminate some options right here?
Yes.
Yes or no? So 4 means we can eliminate the B and C, na?
Yes.
We can eliminate these two options, right? Easily. Next, we need to check A or D. Two options enough. Easy to eliminate the options if you learn the proper approaches. That's why I am explaining you. Identify the sixth question.
D, sir.
D. Third question.
Percutaneous endoscopy.
C, right?
Yes.
24th question.
Via natural endoscopy. B.
Yeah.
Option B.
Option B.
B. 25.
Zero. A.
Percutaneous.
B, sir. Percutaneous.
Incision percutaneous B. 26.
B, sir. External.
External skin level surface, correct? Skin surface external. 27.
C.
Via
Option
natural
C.
or artificial opening endoscopy. Now you get idea about scopies, right? Fifth character. Yes or no, guys? Do you understood the fifth character?
Yes.
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 Next, sixth character device, note down. Sixth character devices. Devices means remains. Devices remains in place after the procedure is completed. Devices remains in place after the procedure is completed. If they done any procedure after the procedure that external appliances was in our body, it should be considered as device. So what are the things we need to consider as devices? They given here, check. Grafts, prosthetic joints, surgical implants, simple or mechanical appliances, electronic appliances. These should be considered as devices. What we should not consider as devices? Clips, ligatures, sutures, surgical drains, instrument to visualize the procedure site like scopies. Scope is we should not consider as the device. This we should not consider. This we can consider. Okay. Because why? Because sutures why we should not consider as device? After some days of the procedure, suture they will
dissolve in the
remove
body.
after 10 to 15 days, they will remove the sutures, right? Surgical drains also, after removing the fluid, they will remove the drain. Clips, ligatures also, they will put for the support purpose.
So
Scope is also, they will insert in our body and they will visualize and examine the body part and they will remove the scopy. It was not permanent in our body, so it should not be considered as device. Like surgical implants, bypass grafts, and prosthetic joints, simpler mechanical like pacemakers, defibrillators, these all considered as devices. Clear? Huh? So for every procedure, we don't get a device, guys. If they placed any device, we need to go with the device. Otherwise, we have no device option. We need to select the no device. Suppose if they want to remove appendix, is there is any need to place the device?
No.
No, right? If they require device, they will place. Otherwise, they don't use the device. So for every procedure, we don't get the device option. If there is no device, you will get the no device option. Next, 7th character qualifier. Qualifier has a specific meaning for each root operation. There is no particular meaning for the qualifier. It was depends on the each root operation. These are the qualifiers. Note down or take the snippet. Qualifier has a specific meaning for each root operation. At the time of root operation discussion, we can discuss the qualifiers also. Qualifier has a specific meaning for each root operation. So there is no separate definition for qualifier. It was depends on the root operation. Clear? So as of now, we discussed 6 characters, right? Except root operation, all we discussed. No? Surgical section 0 we discussed, medical and surgical. 31 body systems I explained. 7 approaches. And what is the meaning of body part, device, qualifier. Except root operation, we discussed all the characters, correct?
Yes, sir.
So based on this characterization, 6 characters, can you identify the procedure, what they perform? Exactly. What is the procedure they perform? The objective of the procedure can we identify? Or you will get a complete code based on these 6 characters? No. Root operation should be important, guys. Root operation means objective of the procedure. Okay. Objective or intent of the procedure. What is the exact procedure they are performing? It should be depends on the root operation. If you identify the proper root operation, you will get the correct code. If you are not finding the proper root operation, for every root operation, you will get the same body system, same approach, same device, same qualifier. Root operation only important in the PCS. Total we have 31 root operation definitions. In this 31, 10 to 12 was important for the exam related. At least we need to learn this 10 to 12 root operation related definitions. You need to buy heart the definitions. Okay. So guys, here total 31 body root operations we have in the PCS book. If you open the table of contents in the starting, appendix A, approach table, appendix B should be root operation definitions. Correct?
So can you repeat once more?
Total we have 31 root operations. Based on the root operation only, we'll get the correct code. Where we need to find the root operations in the PCS book now? If you come to the table of contents, under appendix B, we have the root operation definitions. Where you check the approach table now? Next page only. 801. So here we have root operation definitions. Root operation definitions. So here we have the value, root operation name, value, root operation name, definition, explanation, examples. Okay. So these are the fixed values, guys. Okay. These are the fixed values. If the procedure third character 0 means alteration, One means bypass, to change, like this. But we can learn based on the similarity of each root operation. It will be easy to learn. Rather than the sequence wise, we can learn the similarity of each root operation. Total 31 root operations, they divided as 9 groups based on the similarity of each root operation. First group should be cutting out some or all of a body part. Cutting out some or all of a body part. These are the root operations: excision, resection, extraction, destruction, detachment. These 5 root operations related to removal of a portion or complete body part based on various techniques. Removal of a portion or complete body part. It should be excision. Note down the examples. Biopsies, removal of abnormal growth, excision, excisional debridement, graft harvest. First we can learn the excision. Excision value B. Excision means cutting out or off some of a body part without replacement of a body part. They will remove a portion of the body part. It should be excision. Removal of a portion of the body part, like partial ectomies, partial nephrectomy, partial appendectomy. Okay, partial ectomies. A portion of the body part, if they removed, it should be excision. The excision value was B. So in the excision, note down the qualifier as diagnostic is used to identify biopsy procedures. If they done any biopsy procedure, the qualifier should be diagnostic we need to take. The qualifier value should be X. Diagnostic value should be X. If they done biopsy procedure, qualifier will get as X. Clear?
Sir, can you explain once again, sir?
Excision means they remove a portion of the body part. Okay. So here, what are the examples you will get? Removal of a portion of body part. Note down. Biopsies, like removal of abnormal growths, cancer, polyps, mass, lump also, guys. Excisional debridement, graft harvesting. They are taking the sample for graft harvesting. It also excision. Then partial ectomies. Partial ectomy. Like partial nephrectomy, partial appendectomy. Okay, partial ectomy. Biopsies. So whenever they done the biopsy, means collecting the sample. Biopsy procedures qualifier as diagnostic. Note down. For biopsy procedures, qualifier as diagnostic. If they taken any biopsy, liver needle biopsy, thyroid nodule biopsy, breast biopsy, okay, whatever biopsy they done, qualifier should be diagnostic. 7th character. Noted.
Yes, sir.
Next, resection. T. Resection, note down. Cutting out of all of your body part. cutting out or off without replacement all of a body part. If they remove a portion of body part, excision, complete body part should be resection. Complete body part should be resection, like complete body part or complete lobe in the organ like lung, liver, node, thyroid. If they remove a complete lobe also, resection. Complete lobe also, resection, guys. Like in the lung, if they done upper lobe, lower lobe also, resection. Complete body part or complete lobe, resection. And in the colon, if they're done okay, in the colon, if they're done ascending colon or sigmoid colon, okay, resection. If they're done complete removal of colon or complete portion of the colon, we have the different parts of the colon, right? Ascending colon, descending colon, sigmoid colon, transverse colon also. If they remove sigmoid colon, completely resection. Ascending colon, transverse colon or descending colon, if they remove also, it should be resection. Complete body part, complete lobe or in the colon, complete part like ascending colon, descending colon, sigmoid colon also considered as resection, or complete colectomy also resection. The resection value should be T. You will get third character T. Excision value should be B. You will get third character B. Now tell me first question answer. It was excision or resection?
Resection.
Completely they are removing. So what is the third character value?
T.
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 So based on the resection value T, we are eliminated CD, A, B. Based on the approach, we can eliminate B. So
A.
what is the answer?
A.
E.
A.
Simple. Like this, we need to eliminate the options. Smart tricks we need to play in the exam because everything should be optional. We should not going to code any procedure directly, either CPT or PCS. Everything should be optional. We need to find our exact answer. That's it, guys. These two root operations clear? Excision and resection.
Yes.
Definitions clear means now I will explain book leading. How to use the book and all.
Hello.
Yes, yes.
Sir, what about the case studies then? For that, we don't have any options now.
That also options. Everything exam should be optional, either case studies or multiple choice.
For case studies also, we'll have options. Huh?
Yes, yes, why not?
Okay. Thank you.
Everything should be optional in exam, even you don't get keyboard also to type anything. Only mouse, monitor. You need to click the options. That's it.
Sir, can we continue the next session tomorrow?
5 minutes. It was 1.5 hour question, section, guys. I need to complete earlier. 8 to 9:30. Please stretch your timings. Okay. As earlier also I discussed same thing. 8 to 9:30 our timings. Just open your PCS book. Now I am teaching how to use the book. This is very important. If you understand the book leading, you will get a code. Otherwise, it was very difficult. Okay. Please open your PCS book, PDF. Everybody watch. First thing, whatever we opened, we need to check table of contents. This is very important in the PCS book. Everything you will get here about the book. on particular page what they documented, you will get clear analysis in the table of contents. Now, same like ICD-10 CM, we have index and tables. Here also we have index and tables, guys. ICD-10 PCS index, then tables. ICD-10 PCS index like same dictionary wise, either CPT or ICD. You will get all the procedure codes here. Dictionary wise you will get. So first thing remember, PCS procedure minimum 4 character you will get in the index. Sometimes based on the procedure 5, 6, 7 characters also you will get. But minimum 4 characters you will get in the index. So how to use the index? I will explain. Note down index leading. Guys, you don't go with directly procedure name wise. You don't get. So for suppose I am showing appendectomy they done. We are going to APP. I am checking. APP. Appendectomy. I found the code here. Directly they given or not. What they mentioned under appendectomy?
The excision.
C excision appendix. C resection appendix. Correct?
Yes, sir.
So which means we don't get the procedure directly in index. First we need to identify the root operation of the procedure. In the operative note, for every procedure, we need to identify a root operation. First, identify root operation. After identifying, under root operation heading, look body. Like this only will get the procedure code, guys. Whatever they given, first we need to identify the root operation. Under the root operation heading, we need to look for the body part. Then only possible to get a code. If you are not identifying directly root operation, it was very difficult to get the code. See, now only I saw, if they done appendectomy, if you don't know the meaning of excision or resection, you will get a code. No, right? If you know the meaning of excision and resection, then only will get the correct code. If you don't know the meaning of excision and resection, you will get the correct code. It was difficult now. We don't know what is the exact code. So we need to understand the root operations. If they mention appendectomy, appendectomy means removal of appendix. It was resection. Then you will go with under resection appendix. 0FT, sorry, 0DT, J. Like this. Now, table usage. How to identify the remaining characters. So here we are getting all the tables below the medical and surgical. Each code range in which page starting they given clearly. So 0DTJ, right? Under 0D in this page range you will get 0DTJ means 0D1 to 0DY between. 0B means 0B1 to BY. C means C. J means J. F means F. Depends on the code characters. First characters comes under which page range, we need to go for the particular page range. 0D1 to 0DY 347. I am going to particular pages. So here, whatever you open, you will get in the side. You are in the particular which code range? In the top, you will get 3 characters and they divide the table for body part, approach, device, qualifier. We need to look for the remaining characters here. In the top, you will get 3 characters, then body part, approach, device, qualifier. Now, 0D1, but what we need? 0DT for appendectomy. So 0D1, first we will get the numbers, then letters, guys. Check in the side, 0D1, 0D5, 9, D, C, H, L, N, P, 0DS to 0DT. In this page, I will get the 0DTJ, 0DS, 0DT. I need J, appendix. Any approach they mentioned, we need to go with particular approach. If they're not mentioned approach, we need to go with default open. If they not mentioned the approach, it was default open, we need to consider. Simply they given appendectomy, they not mentioned any laparoscopic, then open. 0 DTJ 0 ZZ. Like this, we need to lead a code. Boring. Got it? Hello.
The recording has stopped.
Got it, sir.
Got it. Yeah, thank you. So tomorrow onwards, join sharp 8 o'clock. Okay, I will take 8 to 9:30.
Sir,
Clear?
can you explain with any another example also?
Tomorrow onwards, daily we can practice the examples. Okay.
Okay, sir.
Same thing we are going to practice in this coming week, complete week. Daily I will show the examples, each root operation, how to lead the codes. We are going to practice every day. Okay. Next 2 to 3 sessions, we are going to practice PCS codes only. Tomorrow onwards, I will show book leading properly and I will give the examples. You need to identify the answers also. Clear?
Okay, sir.
Okay, guys, thank you. All are having doubts, you can stay. Or not having any doubts, you can leave the session. I will share the recording in the group. For having doubts, you can ask one. Fatafat ask na, you have doubts. If you no doubts, you can leave the session.
Hello, sir.
Explain
Ask.
about the qualifier, please.
Qualifier has no specific meaning. Qualifier value depends on the root operation. For biopsy procedures, diagnostic qualifier. Okay. In
Sir,
biopsy,
in the approach, the natural number 7, I did not get exactly, sir. What is that?
natural number 7, no? In our body have some natural roots, right?
Yeah.
In the mouth, nose, rectum, penis, vagina. They will use the natural route and they will complete the procedure like instrument or directly they will insert in the natural route. Like Foley catheter, they place from the penis. Okay. Cervical circlage, cervical clips they will put in the vagina. Or endotracheal tube or feeding tubes insert in the mouth. Tubes and all. It should be natural route. In the natural route, if they insert the scope is 8.
Okay, sir.
In the mouth, they insert the bronchoscopy, EGD. In the rectum, they will insert the colonoscopy. In the vagina, they will insert the hysteroscopy. Scope is insert 8. Instrument insert 7.
Okay, sir. Thank you, sir.
Thank you. Next 42 members, any doubts? See, no doubts means exit fatafat, guys. I want to stay for the leading all, no?